Good evening and welcome to tonight's regional news. We start with a story from Trinidad and Tobago. A mechanic from South Trinidad is raising questions about the operations of a private lab where he was swabbed for COVID-19 and received a negative result. The man said he was swabbed later the same day by the Ministry of Health and received a positive result. He said under the condition of anonymity, he was fearful of losing his job for speaking out. The man said he came into contact with someone who had all the symptoms of COVID-19. He tried to get tested at a health center, but said he was told that he would have to wait until that person's result came back. When the person was tested positive, he was instructed to go to a health center to be swabbed. But he said his place of employment sent him to a medical facility in South Trinidad where they paid for him to be tested. He said he wanted to share his story because when he visited the private testing center, there were people in over a dozen vehicles waiting to be tested in the drive-through testing station. Still in Trinidad and Tobago. Trinidad and Tobago has been ranked as one of the world's developing nations where the COVID-19 virus is surging. A Bloomberg report dated May 3, 2021, quoted data from the Johns Hopkins University, which showed TNT recorded 3,127 COVID cases in the past month, data measured up to May 2, compared to 701 cases in March. Trinidad and Tobago joins a list of countries such as India, Nepal, Thailand, Suriname, among others, where there are record case numbers. It noted that the increase is mainly because of more contagious virus variants, though complacency and lack of resources to contain the spread have also been cited as reasons. Ranked by the change in newly recorded infections in the past month over the previous month, Laos came first with 22,000% increase, followed by Nepal and Thailand, both of which saw fresh caseloads skyrocketing more than 1,000% on a month-over-month basis. In Brazil, at least 25 people have been killed after hundreds of heavily armed police stormed into one of Rio de Janeiro's largest slum areas, reportedly targeting drug traffickers. Local media showed live footage of 7 armed young men hopping through the roof of North Zone's Jacarazinho favela in the early hours of Thursday morning as bulletproof helicopters hovered over them. The report said that, I quote, the extremely suspicious criminals, end of quote, were attempting to escape from the police. 2 passengers on the metro were hit by a stray bullet and 1 police officer was killed. Videos and photos showed grenade explosions as well as horrific scenes of corpses lying in corridors, multiple bullet holes on residents' doors, blood-stained mattresses and clothes, and blood flowing down staircases in the favela's narrow alleys. But human rights activists, residents, and public security specialists were horrified and said that the attack could have been motivated by other factors. One person who was in the favela when the operation took place said that it was unlikely that all the people killed in the operation were criminals. And internationally, people under 40 in Britain will not be given the Oxford-AstraZeneca coronavirus vaccine if another shot is available because of a link to extremely rare blood clots, the government said on Friday. It said the change would not affect the goal of giving all UK adults at least 1 vaccine dose by July. The Joint Committee on Vaccination and Immunization said people aged 30 to 39 without underlying health conditions should receive an alternative vaccine, I quote, where available and only if this does not cause substantial delays in being vaccinated, end quote. Last month, it gave the same advice for people under 30. Up to April 28, Britain's medicines regulator had received 242 reports of blood clots accompanied by low platelet count in people who had received the Oxford-AstraZeneca vaccine out of 28.5 million doses given. There were 49 deaths. That was all for tonight's regional news. Thanks for joining.